According to the latest creation research, one of the world's most impactful doctors online in type 2 diabetes.
But I don't need to tell you the rapid evolution in research and evidence and guidelines. So it's almost a full-time job in itself, keeping up to date. 2010, estimated time of doubling of medical knowledge about 3 years. Guess what it's now, Daniel?
Well, it must be less than that.
Yeah. Estimated time for doubling of all medical knowledge.
Oh my goodness, that's ridiculous.
And so, yes, we are perhaps feeling a wee bit overwhelmed as healthcare professionals, but what do you think our patients feel like? I'd actually put together a presentation a number of weeks ago, but I had to rewrite it 3 times this month because of breaking advances in managing.
Wow.
Yeah, and all those breaking advances I came across online.
What is most exciting to you at the moment in terms of advances in treatment in that kind of space?
Well, everything. Every day is a school day these days. But to be honest, it's the toughest time I've worked in general practice in the last 15 years. And I think that's the future for all of us. Because Twitter or X, it's a curious place in many ways, isn't it? That's good. I don't think everyone's ever asked me that before. Many of my colleagues still do feel there's no such thing as a free lunch.
I first met Dr Kevin Fernando in person at a European medical congress where thousands of healthcare professionals were gathering together to learn about the latest science in diabetes care. But I felt like I knew him already because I'd been listening to him online for years through social media, listening and analysing through the work we do at Creation his impact on other healthcare professionals online. But what I loved about this conversation with Dr. Fernando was discovering just how he talks about social media, first of all, as a tool for him to learn about new medical science and then to share it with others. He's a GP, a primary care physician with a special interest in diabetes and cardiometabolic disease. And he practices from a small town on the east coast of Scotland. But from there, he has a huge impact on healthcare professionals all over the world. I loved learning from him about his predictions for the future of primary care in the UK, the future of social media as a tool for health engagement, and especially the role that industry should and could be playing in engaging with healthcare professionals and stakeholders on social media. Here we go. Well, I'm so glad to be joined here by Dr. Kevin Fernando. According to the latest creation research, one of the world's most impactful doctors online in type 2 diabetes. Kevin, welcome.
Thank you. Thanks, Danny. Cheers.
Could you start by describing your current location? Where are you? What's the view from your chair?
View from my chair. I'm in Haddington, which is a little town east of Edinburgh in Scotland. So I've lived here for a long time. My practice is just down the road, North Berwick, which actually was just voted nicest town to live in the UK in a
fantastic
Times survey just last week. Actually, I think it's the first time a Scottish town has topped that survey. So, but for many years, all the talks have been doing. No one's known where North Berwick is, but now it's on the map.
Oh, that's lovely. That's fantastic. So, can you tell us a bit about the background to you? What do you do? How long have you done it, and how did you get into it?
First and foremost, I'm very much a jobbing GP partner in North Berwick Health Centre. I work 2 days a week there as a partner, Mondays and Thursdays usually, and the rest of my time basically is keeping up to date. But I don't need to tell you the rapid evolution in research and evidence and guidelines. So it's almost a full-time job in itself, keeping up to date. I was chatting actually to our GP trainee recently, telling her about a really interesting paper I'd read from a number of years ago, actually, about the doubling of medical knowledge. So in the 1950s, the estimated time of doubling of all medical knowledge, not just diabetes, was about 50 years. 1980s, estimated time of doubling of medical knowledge, 7.5 years. 2010, estimated time of doubling of medical knowledge, about 3 years. Guess what it's now, Daniel?
Well, it must be less than that.
Yeah. Estimated time for doubling of all medical knowledge is 77 days. But
oh my goodness, that's ridiculous. So how do you handle that? What for you as a GP? I mean, does that mean that the knowledge increases, or that there's just much more information to go out and discover? What does that look like for you practically?
A bit of everything. I mean, another statistic, this I don't have a paper to back up with, but I remember someone telling me in primary care, we get about 250 guidelines a year. to follow across all
Wow.
clinical specialisms. Yeah, so you can see what we're dealing with in primary care. I mean, what I love and hate about GP is you don't know what's coming in the door next, but you've got to deal with it. And I suppose that comes back to the reason for this interview. Social media has been phenomenally helpful over
Mm.
the last. Well, it's been, I should say it's been both a blessing and a curse, but we can come
Yeah.
back onto that. But it's been hugely helpful in trying to keep up to date. If I can't get to some of the latest, diabetes conferences, cardiovascular, someone's going to be tweeting from it. That's where I often hear about breaking news from the MHRA or other drug safety alerts. So certainly that's been hugely helpful in helping me keep up to date. I suppose I'm fortunate in that I work 2 days as a GP, so I've got set aside protected time to keep up to date. But my colleagues in North Berwick who work more full time than me do, they routinely tell me they struggle to keep up to date and rely on people like myself to help keep them up to date.
Right. So that's really interesting because I've seen that, you're actively involved not only online, but also in real life, face to
Yeah,
face meetings and gatherings and so on. So how does social media kind of add to that real life experience and then back online?
yeah, no,
What does that look like for you?
absolutely. Relaying those key take-home messages from whichever educational meeting or other activity I've been doing, or either giving or as a delegate, I think is a key part of being an HCP these days. Again, because of those figures I gave you about the rapidly evolving nature, of medicine. So I see that as a key responsibility of all healthcare professionals. I mean, I can't get to all meetings. My main focus, as you said, is type 2 diabetes, cardiovascular, renal, metabolic. So, respiratory medicine, for example, women's health, dermatology. I rely on many other key opinion leaders to help keep me up to date. And many of them, I find online or find, meet face to face at other meetings. So, relaying medical knowledge is a key responsibility. I mean, in fact, that's where the term doctor comes from, isn't it? It's to teach,
Mm.
the Latin from to teach. So I've always seen that as a key role. It's not easy. It's not easy, of course, keeping up to date and maintaining that contemporaneous flow of information online or in person. But it can be hugely satisfying.
And I've seen that one of the things that you do online is you not only engage with other healthcare professionals, like you say, helping other doctors to learn, but you also deliberately engage with patients, right?
Yeah, so that's something I've sort of dipped my toes into just really over the last 6 to 12 months. But it's really important. We even just over the last couple of years, we've seen some of the biggest therapeutic advances in my career to date since I graduated from Edinburgh in 2000. And so, yes, we are perhaps feeling a wee bit overwhelmed as healthcare professionals, but what do you think our patients feel like? When
Exactly.
where the HCPs are bombarding them with all these new therapeutic or pharmacological or non-pharmacological options. So that's why I think we also have a key role to help educate our patients. The challenge in primary care is time. In North Berwick, we still have 10-minute appointments. So there's only so much you can pack into a 10-minute appointment. So that's why I started a YouTube and TikTok channel. To be honest, I've only done a few videos so far focused on a particular therapeutic class of diabetes drug, which is the new standard of care. But they seem to have landed very well. And, as you alluded to, my mantra has always been to put out information, education that's going to make our lives a wee bit easier in primary care, but ultimately to help improve the lives of our patients. So certainly that's always been my mantra for educating HCPs, but of course for educating people living with diabetes and other long-term conditions. Yeah.
That's amazing. And what is the most effective way that social media is helping you right now? Can you think of a great example of something that you think this is happening now or recently that's a really useful way that social media is helping
Yeah.
in
Well,
I suppose particularly in that challenge that you talked about of the massive advances in
yeah,
medical knowledge?
absolutely. Well, just this morning, actually, I was fortunate. I was invited to speak at the Royal College of Physicians in Edinburgh on managing the kidney patient with diabetes in the community. So I'd actually put together that presentation a number of weeks ago, but I had to rewrite it 3 times this month because of breaking advances in managing.
Wow.
Yeah, and
Wow.
all those breaking advances I came across online on Twitter, LinkedIn, or other channels. So there was a recent study looking at one of the GLP-1 drugs and its impact in diabetic kidney disease. So I was able to add in a slide on that literally a few days ago. KDIGO, one of the big global kidney disease organizations, published new guidelines. So I just saw that on LinkedIn. So I was able to integrate that into my presentation. So yes, it was quite a bit more work for me, but this morning I was very proud to deliver a cutting edge talk in
Fantastic.
diabetes and kidney disease because I was able to include stuff right up to the date that I was alerted to on social media.
So I love that. You're actually sharing some of that knowledge on social media. You're learning from social media. That social media content is feeding into
Yes,
what you've just described as cutting edge knowledge that you can feed into a live
and
meeting, and
absolutely.
then you put it back online.
So the live meeting this morning, there was a face-to-face contingent, but it was being streamed out across the world. The
Mm,
Royal had, so I think there was over 400 people, we were told, across the world. So there, I suppose that nicely impacts nicely illustrates the impact of my
mm,
learning.
mm.
But then, of course, the pitfalls there. I need to make sure that the information I'm giving out is accurate, isn't it, and
Absolutely.
reliable. So that's another key responsibility of mine. I can't just copy and paste, of course.
Yeah.
I need to read, digest, assess myself, and then relay. So yeah. So with to quote, I think wasn't it Spider-Man? With great power comes great responsibility.
Absolutely.
So when I suppose I'm fortunate to have this quite large following on social media and this quite large impact that you've kindly outlined. But with that comes a lot of responsibility. If I put
Mhm.
misinformation out there, that ultimately could potentially have a negative impact on patient care, couldn't it? So
Absolutely. Let's talk about that a little bit
yeah,
because we've seen in recent years that the World Health Organization has talked about a kind of infodemic, and there's been a lot of raised awareness about misinformation online. So, how do you, as a doctor, know what to trust, and how do you help to guide people in knowing to signpost into where's the truth and where's the
yeah,
misinformation?
no, excellent question. A big part of that is my own appraisal of the data, my own appraisal of the studies. But then I have, a trusted inner circle, if you like, as well, that I know that who know the data well, who I trust implicitly, their clinical judgment, their statistical knowledge, who I'm happy to, to take a steer from them as well, because it's just impossible for me to assess every single piece of information I come across online. So you'll know a lot of these other
Mm.
people are people in your top 50 lists as well, aren't they? And
Absolutely. But I love to see how this works out. So you're saying, is it reasonable to say that when you look at a piece of information, who it is that actually shares it will help to determine at a first glance how credible that is?
100%. You'll know one of my good buddies, Patrick Holmes,
Mm.
another GP with a long-standing interest in diabetes. So he's one of the cleverest people I know. So if he tags me in or retweets something, I know it's something that's relevant to my own personal development, professional development, and of course then relevant to my patients. So absolutely. So having those core followers or colleagues online that you can trust, that are not going to put any misinformation out there is hugely helpful too. Yeah.
That's really powerful, and we see that in the data. There's when we talk about you as a digital opinion leader,
Yes,
because of actually seeing who else online seems to trust what you say,
exactly. Yeah,
and we
yeah,
kind of
yeah,
measure
yeah.
that. Yeah,
I mean, I would like to think by the size of my following that people do trust me online, and but again, that carries a heavy
it
responsibility
does.
at times, doesn't it?
Absolutely.
Yeah. So
So
I'm very, I have, have to be very careful about what I post out there, because ultimately, going back to my mantra, what I tweet, I want to help improve the lives of our patients. Yeah.
that's fantastic. Can I ask you about your specific disease area interest, and this is diabetes and related chronic diseases?
Yeah.
What is most exciting to you at the moment in terms of advances in treatment in that kind of space?
Well, everything. Every day is a school day these days. For the last, I reckon, the last 4 or 5 years, almost every day has been a school day. Clearly we're contending with a pandemic as well in the middle of all of
Mm,
that. But even before the pandemic, there'd been huge strides in how we manage diabetes, not just pharmacologically, non-pharmacologically as well. The concept of diabetes remission, reversing type 2 diabetes. And then certainly the last couple of years, very much aware of treating diabetes holistically. Well, we've always done that, but very much
mm,
being aware of associated chronic conditions, kidney disease, like I was speaking about today, fatty liver disease, or the new terminology is MASLD, which I also speak a lot about. So certainly, these changes, these advances have really pushed me to talk about a huge variety of different topics, not just type 2 diabetes, which has kept things interesting for me as well. Yeah.
That's fascinating how that's kind of developing, and we've really been seeing that in the online
Oh
conversation.
no,
We did the study
absolutely,
on,
yeah.
type 2 diabetes conversation, but now there are suddenly cardiologists in there and other kind of specialists really interested in the
I
diabetes
mean,
conversation.
even just a couple of years ago, if you'd told me, "Oh, Kevin, you'll be speaking on diabetes and chronic kidney disease at the Royal College of Physicians," I would have laughed. I said, don't be silly,"
Right.
But it just
Wow.
shows how the narrative has changed, how guidelines have changed to encourage us to focus on these comorbidities.
Well, let me ask you about this. As a GP, you've got some special interests, but what would you say are the biggest challenges or opportunities that are facing GPs, let's say UK GPs, kind of maybe locally for you in Scotland, but also nationally
Yeah.
and perhaps, internationally as well? You talked a bit already about the massive, rapid growth in medical information. What else do you see as kind of key challenges and
Well,
opportunities?
I mean, we can see it every day in the news. Unfortunately, workload is a significant challenge at the moment. Meeting patient demand, patient expectation is next to impossible these days. We're still seeing a legacy, of course, of the pandemic. People who we weren't able to give them the same sort of care for their chronic conditions during the pandemic. So we're seeing a legacy of that. Workforce, we've had a lot of people retire early in primary care. So there's been a real brain drain of some of my very senior, very experienced, knowledgeable colleagues. So we are, yes, I've been waxing lyrical about it's great to have all these exciting advances, but ultimately, we have to see our patients. We have to meet, their care needs, and we're struggling at the moment because of workload and workforce issues. So
Wow.
uh, it's
So
a
what do you
tough
think
time.
needs to happen?
Well, to be honest, it's the toughest time I've worked in general practice in the last 15 years. So so yes, a lot of exciting advances, but we have to face what the reality is now. We're in we're an ebb, unfortunately, in general practice for many reasons. Yeah.
Oh, and what do you think needs to happen then?
Yeah, good question. That's the $64,000 question. Well, I think certainly, I don't know, all of our younger trainees coming in, no one wants to be a full-time GP anymore. I think it's just not sustainable. And I completely agree. But I was one of the very early pioneering portfolio GPs. So I've been a GP partner for 15 years, but very early on, I dropped days to allow me to do diabetes, medical education, etc. And I think that variety in the week has kept things manageable for me, helped my resilience, and ultimately helped my enjoyment of the job too. So
Wow.
I've spoken at a couple of medical schools recently. They've been invited to talk about the benefits of being a portfolio GP, having a specialist interest or an extended role in another area. And I think that's the future for all of us, because working full time, 5 days, 4 or 5 days in primary care is pretty exhausting these days in terms of the workload. So portfolio GP. So I think in many ways, that's what's helped sustain me as a GP partner all these years. Yeah.
So it's actually kind of brought that variety to the role. So it's not just
Yeah.
like
And
hard slog all
I
the
know
way
that
through. It's actually changing.
might sound a wee bit selfish, but it's ultimately that variety, that upskilling in diabetes, cardiovascular, renal has helped my patients, hasn't it?
Absolutely.
My patients trust me. They know they're getting the latest diabetes, cardiovascular, kidney, metabolic care. Yes, I mentioned there the personal benefits, but there's no doubt it's benefits my patients and my colleagues, because a lot of them feel de-skilled in diabetes because it is such a complex area. So I'm the unexpectedly no sorry as expected, I'm the diabetes lead for the practice, and even neighboring practices just drop me messages asking for help. So I
Amazing.
see it as a win-win.
That's great.
Yeah.
But actually, by looking after your own well-being,
Yeah.
you've been able to thrive more. And actually, clearly, the data shows make a great, huge impact.
Oh, 100%. Yeah.
Hi, a quick word. We've just launched this podcast series, so if you're enjoying this interview, please like the episode and follow the podcast. It will mean a huge amount to me, and it will help us to keep getting great guests on the show and keep learning together. Thank you. Great. So thinking about, you've talked a bit about the way that social media has, supported your work professionally and supported your information sharing, but also learning information. So if another healthcare professional was looking to kind of grow their own knowledge and influence online, what advice would you give them?
Yeah. Just do it, I suppose. To quote Nike, Nike, just do it because I mean, I would. Yes, I'm on social media a lot. I do, but I'm still learning. There's a lot I still need to learn, particularly YouTube, TikTok. It's been quite a journey so far. It's an interesting journey. But there's a platform to match everyone's interests, background.
Mm.
I tend to mainly focus on Twitter and LinkedIn. I'm looking at perhaps Instagram and ways to perhaps use that. Whereas other colleagues I know do use Instagram a lot. So I think the key thing is finding a platform you're comfortable with. Finding an area you're comfortable in. You don't even need to have a specialist interest like I do. Just working in general practice every day highlights many puns and dens. I don't know if you're familiar with this terminology. Puns and dens, patient unmet needs, doctors'
Ah,
educational needs. So,
right. Yes.
so that's a key part of our appraisal. If I, as I said, I don't know what's coming in the door next. When I'm doing a clinic. So if someone comes in with something I'm not clear about, I jot that down as a puns and dens. A patient unmet need because I wasn't quite sure what to do. So what do? I'll go and I'll use social media. I'll use other resources to find out about that condition or the complaint, how I can manage it. So I think that's a good start. That's what I tell my GP trainees. Talk about your puns and dens. Of course, we've got to be mindful of not giving out patient identifying data, but talk about the
Mm-hmm.
puns and dens, the clinical presentation, and then you're using your puns and dens to help educate others who might be in that position in the future. So I think that's in many ways, a lot of the education content I put together writes itself just from the days I'm in surgery.
Yeah.
If I'm stuck on something, a patient comes in, I've just no Scooby what to do. I said, oh, I think I'll do a presentation on that, and it makes me, the best way to learn about something is to teach on it, isn't it?
Absolutely. Figure it out. And yeah. So you talked about LinkedIn and Twitter, some of the key
Yeah,
channels. I know you're using other channels for patient facing
yeah,
work
yeah.
as
So
well.
YouTube.
But what does it look like practically day to day? I mean, how much, I'm sort of thinking to myself, how much time does Dr. Fernando spend on Twitter, every day? What does it look like?
Yeah, well, I mean that's the other thing. Again, talking about resilience. You could spend your whole day on this, or all your spare, in between patients, even couldn't you?
Mm,
Or after clinic. So I think we have to be mindful of the time because the time just gets swallowed up on Twitter. So that's why I try and focus. You see the sort of things I do. I'm certainly not a daily poster. On these very. I try and post 2 or 3 times a week. Content that I feel will have a tangible impact again on either my patients or my colleagues. Certainly, people like Patrick Holmes and others in your top list. In fact,
mm,
some
mm.
people in those top five are quite frequent posters, aren't they? And
Prolific.
I think the same, Daniel. I think, how do you have the time to do all of that? I mean, it's great content, but how do you find the time? So I think again, you have to look at your own work-life balance, your
Mm.
own time in which platforms you use and how often you tweet or post. But there's
And
no
what do you
doubt
think
time
about?
management is a real challenge. Yeah.
Yes, absolutely. No, that makes sense. Okay, great. So I like that. It doesn't seem to kind of take over your life, but you've kind of got a balance there
Yeah.
a few times a week. And then, um, what do you think about? I mean, Twitter itself, or we should call it X, but
And
nobody
nobody
that doesn't
calls
seem to really
it
catch. It calls itself X,
yeah,
but no one talks about it as X anymore.
yeah,
It's sort
yeah,
of happened for a while. Obviously, it went through quite a lot of disruption
yeah,
over the past year or so as Elon Musk took over the company. We all wondered maybe for a moment, is it going to keep
yeah,
running? Is he
yeah.
going to shut it
Absolutely.
down and so on? We did see some doctors leave X and go on to Mastodon or
Yeah, yeah,
Threads or some other platform, but eventually kind of say, well, Twitter gives us the kind of community. What do you think? How was that process for you? Did you
yeah.
get concerned about that? Did you
Well,
think you might go somewhere else or?
I mean, Twitter or X, it's a curious place in many ways, isn't it? I mean, I
Yeah,
stay
yeah.
out of all the politics. I stay
Ah,
out,
good.
I purely use it as an educational arm. I learn a lot from it, and I hope people learn a lot from what I post. So I think when I just stuck to that, it was fine for me. But unfortunately, not just X, but a lot of these other channels are increasingly vitriolic places. And that worried me actually. That very much did worry me. But my aim, I think that's another thing that my key advice for everyone considering going onto social media, what is your aim of going on that social
Hmm.
media channel? So I've told you my mantra several times already. That was my mantra. So that's why I'm using these social media channels. I occasionally use Facebook, for education, but mostly for for personal reasons. But my main use of social media is that mantra. So I think it's very important to know your why, isn't it, when using it?
Yes,
And
absolutely.
because I knew my why, even with this turmoil that was happening on Twitter, stroke X, I was able to weather it. Because ultimately, I still think it's a great platform for getting out. Because you're forced to be concise, aren't you?
Exactly.
And that's what I love about Twitter. And in fact, tutorials I do for my GP trainees, I ask them to answer a clinical question in the style of Twitter. So
Ah,
they
brilliant.
can't waffle on. They have to give me a nice, concise answer. Maybe I'm not quite as harsh as 250 characters or whatever it is. And I love the fact that you have to be concise. And you can imaginative use of emoticons or emojis
Yes.
can really add to those postings. So again, my good buddy and colleague Patrick Holmes is excellent at that. So that's why I stuck with Twitter stroke X, because I still think it's a great platform to get those key messages from Congress highlights or breaking research, etc.
Exactly. No, that's fantastic. That's brilliant. What would you do differently if you were kind of starting over
Oh,
in if you were just going online now and you're
yeah.
thinking, oh, actually, and because you really have, it may not have been your original goal to go and become one of the world's most influential doctors in diabetes, but that's kind of
It's
that's where you are, right?
I absolutely promise you that was never my goal or
No,
expectation.
no,
I'm
but
just
it's happened through how you work
yeah,
and maybe what you've expressed about how you learn from it, learn from social media, and then you share that knowledge and kind of we think about amplify that knowledge to others,
yeah.
and it's led people to listen and follow. And what would you do? Yeah, what would you do differently if you were starting out?
Yeah, well, that's good. I don't think everyone's ever asked me that before. Inevitably, I've made mistakes. I'm sure you have as well, Danny. We all make,
Yeah.
Twitter, social media has been a learning curve. But then I suppose making those mistakes has made me a better user of social media as well. So, it'd be quite easy to say I'd go back and not do that. But actually, in many ways, making those mistakes, has focused it.
Oh
So
yeah.
I've got to be honest, I probably wouldn't do anything particularly differently. I've quite enjoyed the journey in many ways. There's been a few wobbles along the way, but as I
Mm,
said, I've learned about them. So I think, to be honest, I probably wouldn't do anything differently.
brilliant.
Others would argue. I've definitely had conversations. People would maybe have a more targeted strat or have a more organized strategy. I suppose I never had a documented strategy on what I was going
Hmm.
to do. It was very much ad hoc, driven by these puns and dens I told you, or other clinical dilemmas I come across. But it's worked for me, as you said, hasn't it? And I suppose it just reflects, because one thing I have been accused of the past. Oh, you just go to all these conferences, speak in all the meetings, you never see any patients, and that hurts actually, because I'm very much a jobbing GP, and I like
Mm,
to see
mm,
that. I hope people would see that reflected in what I post. Like, for example,
mm.
I've just launched a podcast for global podcast from Medscape, and every episode is just about puns and dead. So the
Wow.
the first one is about penicillin allergy in primary care. Well, half of our
Oh wow.
patients seem allergic to penicillin or have been
Mm.
erroneously, because I'll talk about that. I just recorded one on restless leg syndrome. Patient came to see me with really debilitating restless legs. Already tried a few treatments and I was a bit stuck what to do next. So I thought, I'm going to make a podcast out of this. And I've recorded it, and I've now been able to go back to the patient and actually say, I've got a couple more options for us to try to do. So, it's a win-win.
Brilliant. Brilliant. Oh, that's fantastic. So you talked a bit there about the kind of conferences and events that you get involved with, and I guess some of the organizations that you get involved with. Can I, and I'm conscious also from what you've described that, there's a lot of kind of that peer trust that
Yes.
happens between yourself and other healthcare professionals, and you get to know them online, some that you may know in person, but perhaps some that you get to know online and develop trust and so on. What should the role of industry, I mean, when it comes to medicines, let's say the pharmaceutical
Yeah.
industry, what role can the industry play to support? I mean, we talked about the challenge of, the massive growth in medical knowledge and
Yeah.
the need to keep learning and sharing. What role legitimately can industry play to support you?
Oh, industry have a key role in providing that education. I mean, we, unlike my colleagues I've known for decades from uni who work in finance or other industry, they all get very generous stipends to attend courses, to progress. additional qualifications. We in the NHS, we have to pay everything for ourselves. All my postgraduate qualifications, all the courses I go to. I mean, there's a lot of free courses I pay for myself. Which adds up over 20 plus years. So that's why I over the years I've had no problem attending industry sponsored education, again by people I trust, who I know is going to give me objective information. So I think industry do have a key role there. The challenge though is, many of my colleagues still do feel there's no such thing as a free lunch. And
Mm.
Ben Goldacre has written that book, hasn't he? And I suppose we could talk about this another day, but that subliminal influence in these meetings. But again, when you go back to those figures, I tell you, the doubling of medical knowledge, we need to keep up to date. Yes, I organise various courses, give them, but I rely on industry and other partners to keep me up to date as well. So, but I suppose industry is still suffering from the legacy of the 80s and 90s, when it was a lot less regular. I can
Mm.
talk from this from experience. Well, I was in that transition period. I graduated about 2000, but my dad is a doctor, or retired now, very much a doctor in the 80s and 90s, when things were completely unregulated. So I know the sort of nonsense that went on. So unfortunately, the legacy of that is still having an impact on the trust between many
Mm.
HCPs. But things have, arguably, things have gone very much the other way now. I think probably regulations are too tight now. Um, so I suppose it's finding that happy medium, rebuilding that trust, industry rebuilding that trust with
Mm.
HCPs. And of course, I'm not naive. Industry have their commercial agendas, but
Of
there
course,
can be,
yeah.
of course, there's a happy medium there, where we can help, maybe help achieve that commercial agenda, but also provide high quality education to help improve the lives of our patients. Yeah.
So do you think, and you talked about trust there,
Yeah.
do you think that is there caution towards industry when it comes to being on social media, industry's presence on social
Yeah,
media, do
yeah.
you
I
think,
think.
among
Well, I
healthcare
think
professionals?
many companies just don't go anywhere near social media,
Mm.
because of the inherent pitfalls. And a lot of companies, diabetes companies, do have quite helpful information, patient-facing videos on their company websites, but HCPs are reluctant to click through to the big industry name, the big names in diabetes. They won't go through the websites for the reasons I've mentioned. There's definitely some reticence there. So I suppose that's
Mm.
why social media is helpful. Other key opinion leaders. I speak on the behalf of many of these companies, and I declare my conflicts or disclosures. But I still give. No company will ever pay me to say anything.
Yeah.
I will give my objective opinion. Um, and companies know not to approach me if they don't expect a straightforward and honest, objective presentation from me. So again, I hope people, even though I speak on behalf of various companies, I hope people, trust what I have to say, and then ultimately, I suppose that has a beneficial knock-on effect on the company in question too. Yeah.
Yeah, of course. And how important is that to you in terms of your own professional development and reputation? That sense of being trusted to be objective when
Oh,
it comes to that engagement with industry.
very important. Sadly, as I alluded to, I've had my probity challenged, a few times over the years, and I do find that incredibly helpful. As I said, no one will ever pay me to do anything.
Mm.
I'd say anything, specifically. I will always give an objective, but there's no doubt, guilty by association. People assume because I'm speaking on behalf of a particular industry partner that I'm going to toe the party line. Certainly, well, that's what I've been told in the past. But I think that's unfair personally. But
Yeah, it's a tough dilemma, isn't
yeah,
it? I can see. Yeah. Okay, let's talk about the future. Let's finish by talking about the future. Where's it going next for you in terms of social media engagement? How's it going to help you to achieve, better
yeah.
outcomes, better health?
I definitely want to expand my patient-facing offerings. So YouTube, as I said, I've got those 4 videos at the moment, all about a particular class of drug. But I've just recorded another set of videos on lifestyle intervention and type 2 diabetes, cornerstone of the management of type 2
Brilliant.
diabetes. So they're not released yet, but the ones I've done have landed extremely well. So and my by compliments from HCPs, but particularly I send them out to my own patients living with type 2. We just text out a link to the YouTube channel. So yeah,
Brilliant.
patients find it quite amusing that their GP has a YouTube channel, but actually the feedback from them has been very positive. So that's really what I'd like to expand my patient-facing offerings, because again, with all these new therapeutic options and other management options, we need to keep patients well informed. I suppose if we specifically talk about medications, and I'm not trying to medicalize diabetes or any other long-term condition, these drugs only work if patients take them regularly, don't
Yes.
they? So we need, so that's why I did those SGLT2 videos to talk about the benefits, why you've been prescribed it, but also, to be honest, and balance that out with potential adverse effects, and side effects. So I think if we can present information in a patient-friendly manner and honest opinion, I think hopefully there's more chance my patients will take that tablet regularly and in the longer term. Yeah.
That's fantastic. And you talked there about how, as a GP, those videos have been helpful for your patients and also helpful for you because you've been able to direct patients to those videos.
Yes.
Have you found that other GPs have also been able to use your videos as a resource
Yeah,
to
yeah,
help their
absolutely.
patients?
I've had some, if I say so myself, I've been delighted with the response. I've had
Great.
physicians or GPs from across the UK and some abroad as well who've asked permission to signpost. I said, they're freely available online. Do what you want with them. So they've been signposting. There's a lovely GP from Somerset who actually emailed me, said she's been sending that out for all patients newly prescribed on SGLT2s, links to my YouTube channel. So, and I've
Fantastic.
just, even in the last few months, I've definitely noticed a big increase in viewers and subscribers. It's a while till I'm the next Mr. Beast, but I've got now. I think I've got nearly over 300 subscribers now, and certainly the views per video have jumped up quite a bit. So it's nice to see that some people anyway, are finding them helpful.
Fantastic. Well, Kevin, thank you so much for taking the time to have a conversation with me today. Where can people find you online?
Well, as I said, my main channels are LinkedIn and Twitter. So Twitter, my Twitter handle or X handle at Dr Kevin Fernando, Dr Kevin Fernando, and similarly on LinkedIn, I'm at Dr Kevin Fernando. My YouTube channel and TikTok channels also use the similar handle to my X channel, so they're all at Dr Kevin Fernando. So for consistency,
Fantastic.
so for as I said, my YouTube and TikTok are mainly patient-facing content, whereas LinkedIn and Twitter / X are HCP facing. Yeah.
This has been Better Listening for Better Health. I'm Daniel Jin. Thank you so much for listening. If you enjoyed this episode, please don't forget to follow or subscribe so you don't miss the next one. If you loved it, please tell somebody and tell me what you liked. Comment or email me at daniel@creation.co. And whatever you do, keep listening.